because of the number of patients and the surge of COVID patients all over the hospital, everything was put into near constant use, especially the high-end equipment that we usually use in the ICU, our monitors, our mechanical ventilators. A lot of time was spent working with the device manufacturers. And this could be anything from advocating, trying to fix something simple where we didn't really need them to come in to fix it, but they could do it themselves, but they weren't really allowed to. Right to repair is the idea that our devices and equipment as consumers, when we buy and own the device, we have the ability to actually be able to fix them when they break. The medical right to repair is to be able to fix these things, right? We need access to not just information and repair manuals, but also the parts, tools, and most times software to be able to fix these things.
We're trying to make medical devices themselves easy, more accessible, but also at the same time, make sure we balance that security and the privacy so that we can make sure that there is, the ability to repair doesn't cause any sort of, huge security vulnerability that then puts patients in danger.
A lot of the COVID patients not only required a mechanical ventilator, but they all required hemodialysis. We ran out of dialysis machines in the ICUs to the point where we were having to share dialysis machines between patients. One of our community hospitals, one of the machines went down for repair for a minor thing. Something got stuck in, I think, one of the ports for where the patient is connected to it. That, from my understanding, is a simple fix. But unfortunately, it took a good amount of time before we were able to get it back online. I think it took about a week before the folks who had to get in and fix it were able to do that, and we were able to put it back into operation. It's kind of scary, I would say, to any patient arriving at that hospital because they wouldn't know that, right? They would show up not knowing what they need. As sort of clinicians, both in the emergency department and ICUs, we were already at our wits' end in many ways with COVID and working with COVID. However, this sort of added to it just because we all felt that we couldn't provide what we wanted to the patients at the right time.
The patient comes in, we're very specific on the tools we use, and we're very specific on how available they are to the patient. And we want to make sure that we really understand how this tool works and how open it is and how repairable it is, right? Because it's not as easy as going from one device to another, like in any sort of consumer device.
It shows the fragility of our healthcare system to the point where, at minimum, I think we need to think about medical right to repair in an emergency situation to give our biomedical engineers in the hospitals the ability to take care of patients during these crazy times. Get involved with this. Reach out to your legislator. Then also speak with public advocacy groups too, including US PIRG. If you have any clinical friends, physicians or nurses, employ them to talk to their local biomedical engineers. Hopefully we can bring folks together to talk more about this.